Chapter 9, Evaluation and Management, Part 1. Outpatient Services Coding. These are services coded using the numbers 99201 through 99215. These are services that are provided in the offices, ambulatory setting, emergency room, hospital observation area. They're divided into your categories are divided into two subcategories, which include new and established patients. The definitions for new and established patients was discussed in the previous chapter. There are different categories and subcategories for hospital services. These use the codes 99217 through 99239. There are four main groups. They include hospital observation services, hospital inpatient services, observation and inpatient care services, and hospital discharge services. Hospital observation services include services, these are services that are provided when it's unclear whether it is medically necessary to admit the patient to the hospital as an inpatient. Observation care discharge services, these include the physician's exam, discussion with the patient and or family, instructions for continuing care, and for all discharge records. Initial observation care includes the initiation of observation, supervision, and the care plan and periodic reassessment. Subsequent observation care includes reviewing medical records, test results, and changes in the patient's history, exam, and responses to management that have occurred since the last assessment by the physician. Hospital inpatient services. There are two subcategories. Initial hospital care is only reported by the admitting physician and only for the first inpatient day. It is only reported once on the doctor's date of admission, even if the admitting physician sees the patient more than once during that day. Subsequent hospital care may only be reported once per day, and it includes reviewing medical records, results of diagnostic tests, and changes in the patient's history and exam. Observation and inpatient care services. These are services that are provided, they include admitting and discharging the patient on the same day. They must meet all three key components, and they include the nature of presenting problem, but do not include a time component. Hospital discharge services describe the total time the physician spends discharging a hospital inpatient. Your time elements include services provided by the discharging physician on the discharge day, final physician exam, instructions for continuing care, and prep of the discharge records, prescriptions, and referral forms. The time should be documented for these services. Consultation services are coded with the number range of 99241 through 99255. These are E&M services provided by one physician at the request of another physician or provider. The purpose of a consultation is to recommend care for a specific condition that would be managed by the requesting physician, and to determine whether to accept the responsibility of providing care for all or some of the patient's ongoing medical problems. It requires three basic elements: a request, a render, and a response. And there are different types of consultations: office or other consultations, and inpatient. Emergency department. This is code range 99281 through 99285 and 99288. These are considered outpatient services. There's no distinction between new and established patients when you're coding from the emergency department. These codes will require all three key components and must be met. Other services include directing emergency care in a remote location via two-way communications with a rescue personnel located outside of the hospital. Critical care services, 99291 through 99292. These are reported with two time-based codes. 99291 is used to code the first 30 to 74 minutes of critical care services. The add-on code of 99292 is used to report each additional 30 minutes. Critical care services include the interpretation of commonly used diagnostic tests or physiological measures. Procedures include gastric intubation, temporary transcutaneous pacing, ventilator management, and vascular access. E&M codes are also used in other settings, such as nursing facility services. The initial nursing facility care is provided on the day of admission to the facility. Subsequent nursing facility care is reviewing the medical records, results of diagnostic tests, and changes in the patient's condition since the last visit. Nursing facility discharge services include this is the final day of services, and it includes the final examination, discussion of nursing facility stay, instructions for caregivers, and prep of discharge records, prescriptions, and referral forms. A domiciliary rest home or custodial care services. These are facilities that provide private room, board, and personal assistance services. New patients will require all three key components. Established patients will only require 2 out of the 3 key components. Home services are services provided in a patient's home. For a new home service, we would have to have 3 out of 3 of the components. Established, again, only 2 out of 3 is needed. Prolonged services and the timeline factor. This is 99354 through 99360. Prolonged services, physician services without direct physician contact. These are add-on codes. They're used in addition to any other E&M code when a physician provides prolonged services that are beyond the usual time for the underlying E&M service. It involves direct contact with the patient, face-to-face time of outpatient services, and units of time for inpatient services. Prolonged physician services without direct contact must be related to other E&M services provided, but that service need not occur on the same day as a prolonged service. Physician standby services. These are when a physician requests that another physician stand by in case their services are needed. Physicians providing standby services for one patient cannot provide services to other patients during the standby period. Case management and care plan oversight services. This is 99363 through 99364 and 99366 through 99368. We have our case management services where the provider provides direct care to a patient and also coordinates, initiates, and supervises or manages access to other healthcare services required by the patient. Our anticoagulant management includes warfarin therapy over 90 days, and it includes ordering and interpreting the INR test, providing patient instructions and adjusting the patient's dosage. Medical team conferences involve face-to-face participation by 3 or more healthcare professionals from different specialties, each of whom is providing direct care to the patient. Care Plan Oversight Services. We're going to use code 99374 and 99375 to describe physician's supervision of a patient under the care of a home health agency. And code 99377 and 99378 is going to be used for oversight of a hospice patient. Preventative medicine services. These include an age-appropriate history and physical exam of a patient. It's also referred to as a comprehensive service. Counseling and risk factor reduction and behavior change intervention is included, and these are services provided directly to the patient and or family to promote health and prevent illness or injury. Special E&M services are coded with 99441 through 99456. These include telephone services. This is a non-face-to-face E&M service provided over the telephone. And codes depend on the amount of time the provider spends providing medical discussion. Online medical evaluation is a non-face-to-face E&M service by a physician using the internet in response to a patient's online request. Other special E&M services include evaluations of an individual prior to the assurance of life or disability insurance policies, or the examination or to examine individuals who claim to be disabled. E&M services for pediatric patients. You're going to use 99460 through 99463. This includes newborn services. This is from birth to 28 days of age. These are normal newborn services, delivery, birthing room attendance, and our restoration services. Resuscitation services, inpatient neonatal intensive care and pediatric neonatal critical care. Includes pediatric critical care patient transport, inpatient neonatal and pediatric critical care. Includes the initial and subsequent days of critical care services provided to neonate infants and children under 5. Initial and continuing intensive care services include the neonate that may not be critically ill but may require observation of frequent interventions.